If you're prescribing stretching or doing any kind of releasing for your client's tennis elbow, I gotta tell you, it's not gonna work, and it's probably making it worse. And I'm gonna show you how to fix it with one simple exercise. Now, first off, before we prescribe anything, we have to know what kind of problem we're dealing with. So just using your active and passive range of motion testing to see what your clients can do with their wrists and their elbows will tell you, is this a stretching problem or is this a strength problem? Now, when we look at active range of motion, can they get to that full wrist extension? So you can see my right one is a little bit more restricted. I'm not hitting that 80 to 90 degrees. When I overpress, I can kind of get there, but it's stretch, right? So when I look at my left, that's not a problem. If I flip over and then I extend, well, it winds up even more. And I've also got limited supination. So when we start looking at, okay, well, flexion is fine, no problems there, but yet I have pain on the lateral elbow, but extension is not great, and we got to stretch. And then when we look over at supination, supination is not great either. And then when we go into wrist extension, that's also not great. So we got to start thinking, well, if wrist flexion's fine, it's not a tightness problem here. We actually have a tightness or tissue restriction on the opposite side. Oftentimes what we see with a tennis elbow, when we see a representation or a patient presentation like this is being lengthened and weakened over time. So it's not an overuse, so to say, problem. It could be a force distribution issue. And because people often are working at their desk all day and they're in this pronated flex position, this gets lengthened and weakened, and this gets tight and short. So what we need to do is we need to stretch the opposite side of the tennis elbow, get the inside here, do your needling, work on the inside here, maybe on the inside of the arm. There could be some nerve issues, but that's for another video. So once you've taken care of the inputs and altered the inputs on the tight side, then we're going to integrate some new movement on the backside. I can't count how many times I have patients coming in with this chronic tennis elbow. They don't play tennis. They're often computer workers. They're often using their hands in a flexed grip position all day. And then they're seeing another practitioner, and for months, they're needling this area and they're stretching this area, and they're beating up the area that's already beat up. And I'm like, did they even look someplace else? Did they even look down the kinetic chain? Did they look at what the wrist is doing? Did they look at what the shoulder's doing? Did they check the nervous system? You know how many tennis and golfers' elbow stem from the neck and shoulder dysfunction? Because the elbow is often that area of abuse, because it's the transition joint between the hand, wrist, shoulder, thorax. And if we have proximal problems or we have distal problems, that elbow tends to get beat up. And it really frustrates me that patients are wasting their time and money and not getting solutions. And the therapist that they're seeing is just still chasing that pain, keep needling it. That's the problem. Doing the same thing over and over and expecting a different outcome. That sounds a little insane to me. So my goal in this video is to get you to think critically. Look at the body as a system first. Look at the parts above and below. Don't just chase the pain, but start to really look for the problem. Look at the parts that aren't moving. Get them to move like they're supposed to move, and then go after that painful area. But when you start treating the problems, you'll often find the pain tends to go away. Before I show you a solution, if you're finding this information helpful or interesting, head over to amtcertified.ca and learn how to really hone your orthopedic skills, movement assessments, and exercise prescription to the best of your ability so you get greater outcomes. So onto the solution. So we've stretched the inside of the elbow, okay, to kind of create some space to reduce the tension on the backside. Now, the exercise I'm going to show you, it's a very high-tech piece of equipment. They're very hard to find, but I'm sure you can get it or find them anywhere. Little elastic band. I know, this one's from a broccoli. So take an elastic band, put it around the tips of the fingers. And if we think about, what we do with our grip all the time, we're gripping, we're flexed. So we get tight here, and then over time, this can become long and weak. So if you do your muscle testing on the wrist extensors or the supinators or the finger extensors, you're often gonna find, oh, that's actually quite painful and weak. Well, if you release the inside of the elbow, that can get better, but there still might be weakness there. So we need to create balance around the elbow so that the flexors aren't dominating and this isn't chronically getting stretched, creating those tendonitis, tendinopathy issues. or overuse problems. So take your band, and we're just gonna open. We're gonna create this claw, kind of this open grip. And we're gonna do isometric holds. So when you think about the grip, we grip and we move the upper limb. We don't sit there and do repeated grips. So we're gonna do the same thing on the backside. And plus, when we do isometrics, it strengthens the tendons. So it strengthens the connective tissue. And for about 10 to 30 seconds, depending on, if we've got a painful tendon or if we just need to increase strength. So we're gonna do this claw. And we're not gonna do open and closers. We're gonna do isometrics. We're going to hold it out in front. We're gonna do some rotation up above. We're gonna do them out to the side. We're gonna do it behind. So we're training that open grip. We're training the finger extensors to work with the upper limb in different positions, because that's essentially how we use it. So once we've done a couple rotations in every single position, give it a break, do some stretching again to reinforce that. After about 30 to 60 seconds of mobility work or trigger point work, hit it with another repetition. Do 3 or 4 rounds of this, and then retest and watch how your patient's elbows start to feel better pretty quickly, because again, we're not just beating up on the area that's getting beat up, we're actually going after the problem, and oftentimes it's on the opposite side of the elbow. And we can use different testing. We use manual muscle tests, we can use resisted range of motion, but your active passive resisted range of motion testing is going to tell you a lot about the possible solution or the problem to someone's painful area. So we don't want to discount that, but you have to know what is optimal range of motion and what are the sensations that people are feeling. If I am looking at wrist extension and I'm pressing, and it's not a stretch, but it might be a pinch, might be a joint issue. If I check that neural tension, if I'm getting numbness, tingling, ropey, pulley sensations, it might be a nerve issue coming from the neck. So all of these can contribute to that lateral epicondylitis or that tennis elbow. But it's important to find out why that pain is there, not just the what. And if you're really interested in that, we're going to go over nerve mobility testing, joint restriction mobility in the next video. And if you're super serious about really honing in your skills in your orthopedic practice, your movement practice, your manual therapy, check out amtcertified.ca and get certified today. I'll see you there.